Health Canada has approved the use of a weight loss drug to reduce the risk of non-fatal heart attacks. Novo Nordisk says their drug Wegovy is the first federally approved treatment that does both. Wegovy is chemically known as a semaglutide. Since 2021, drugs like it have been approved to treat obesity. But this week, Health Canada gave its stamp of approval to Wegovy for reducing the risk of non-fatal heart attacks. The notice says it applies to adults with established cardiovascular disease and a body mass index equal to or greater than 27 kilograms per meter squared. In Canada, heart disease is the second leading cause of death after cancer and a leading cause of hospitalization. Based on self-reported measures from the 2022 Canadian Community Health Survey, close to 1 in 3 Canadians aged 18 and older were obese in 2022. Okay, for a deeper look on all of this, we're joined now in studio by our medical contributor, Dr. Samir Gupta. Thanks so much for being here. So, we have talked about the weight loss drugs, Ozempic, Wegovy, and we know it's good for weight loss, but the impact on heart attacks, let's talk about that, particularly when it comes to Wegovy.
Yeah, so first thing is it's important that you mentioned Ozempic because a lot of people out there still know it as Ozempic. It's the same molecule, semaglutide. It's called Ozempic when you use it for diabetes, called Wegovy when you use it for weight loss. Same thing, a little bit higher doses. In fact, it's been used in diabetes for over a decade. It was noticed that people who were using it for their diabetes were losing weight. It was then investigated for weight loss, and it does a couple of things. It suppresses the appetite at the level of the brain. It slows the movement of food through the gut, through the stomach, so that people feel full for longer. So very effective for weight loss. We also know that weight is associated with many different chronic diseases. Having overweight or obesity, we know drives higher blood pressure. Higher blood pressure drives more heart attacks and strokes. And so the question behind some of these trials is, can we affect some of these other endpoints? Can we actually not only help people to lose weight, but actually improve their chronic diseases? And so there was a large trial called the SELECT trial. And we know this works in diabetics, but this trial said if you're overweight, if your BMI is 27 or higher, but you don't have diabetes, but you do have a history of cardiovascular disease, does this drug actually reduce cardiovascular events? So massive trial, 17,500 people, half of them got the drug, half of them got a placebo. They followed them out for 3 years. And those who got the drug had about a 20% lower risk of having a heart attack, a stroke, or dying from a heart attack or stroke. And each of those outcomes improved. So it's on the back of that trial that we now have approvals, and it's been approved in Europe, in the US, and now in Canada for prevention of cardiovascular events in people who are overweight and have a history of cardiovascular disease.
Okay, and as you said, there are a number of conditions that can be associated with obesity. Could this drug be used to treat other conditions then that are related, other than heart attacks?
It can be, and we're learning more and more about where it will be effective. Not only this drug, there are other drugs now in this class and new ones coming. So it's it's an exploding area in medicine. But there have been studies showing, for example, in diabetics, it can help with chronic kidney disease. In non-diabetics, it can help with sleep apnea. Sleep apnea is something quite common. People who are often overweight don't have proper sleep because their airway closes off at night. It's been shown to improve that condition. Been shown to improve pain in the knees from osteoarthritis. So mechanical joint disease, often driven by weight and the impact of the weight on the joints. We have trials now showing that the knee pain gets better with this weight loss drug. We have trials in fatty liver. So many different conditions are being targeted now. And one by one, we're seeing that the drug is effective for many of these chronic conditions.
Are there people that this drug is not good for and that should really steer clear of it?
Mainly, it's about side effects. It's about whether you can tolerate it. So, there will be, in the weight loss trial, 7 to 10% of people couldn't tolerate it because of side effects. And most of those side effects are going to be gastrointestinal. You're going to have, some people have abdominal pain, nausea, vomiting. Some people have diarrhea, constipation. In the longer trial, the SELECT trial that I mentioned over 3 years, actually 17% of people had to stop taking it for side effects. That's a bigger number. It was 8% of the placebo group, so the delta is still in that 7 to 10% range. But there will be people who can't tolerate it. The other thing we're learning more about these drugs is that it's not only fat loss, it's also muscle loss. So a concern in older populations with less muscle mass. What's the impact going to be at these doses long term, different than the diabetes doses? So that's something we're learning more about, and there are more concerns. But really, it's about whether people can tolerate it.
Right.
And people who have these chronic diseases, it has to be evaluated in that way.
Last question. Once you start taking this drug,
Yeah.
do you have to continue taking it, or can you stop at a certain point?
Yeah, I mean, it's like, people often say, well, it's not a cure.
Right.
Well, what chronic disease do we have a cure for?
Right.
That's why they're chronic diseases. So if you have high blood pressure, you need blood pressure meds. When you stop taking them, your blood pressure goes back up. If you have diabetes pills, you stop your pills, guess what? Your sugar goes back up. It's very similar here. So if you stop this drug, the trials suggest that most people will gain back weight. Now, you may not gain back all the weight, but most people will gain back weight. And that is a time to then take those measures and start working again throughout the period where you're on the drug, but continuing, if you come off the drug, on diet, diet change, exercise, all the other lifestyle pieces. But for most people, there will be a gain in weight after stopping.
Okay, doctor, thanks so much. Appreciate it.
Pleasure.
Our medical contributor, Dr. Samir Gupta, joining us here in studio.